So you'll be oriented to the simulation environment, and after the room orientation, our assigned observers will proceed to the room to view the simulation, while our registered nurse remain. I will give time for everyone to get settled, then we will start the simulation. And Ashley, you've already chosen your role.
Yes, I did.
So you've all been given the simulation learning objectives as well as how to care for the patient. Before we start the simulation, do you have any questions? So let's proceed to room 1.
Hi, I'm ready for a report. What a night. You're getting 3 patients from me, you'll probably get more. ER has been calling all night. Ready?
Yes.
Patient is awake and awaiting transfer to Metro Hospital Center for a cabbage. Patient is Zeb Haley is a 59-year-old female who was transferred here for a cardiac catheterization after presenting to their community hospital emergency department with chest pain. The troponins were elevated and the 12-lead ECG confirmed a myocardial infarction. The cardiologist who did the cath said that the disease was too extensive to treat endovascularly, so the cardiothoracic surgeon was consulted. The CT surgeon saw the patient yesterday and explained that the long history of smoking, hypertension, and diabetes makes her a high-risk patient and they can't do the surgery here. The patient is transported to the Metro Hospital Center today to get prepped for an open heart surgery in the Cardiac Specialty Center. The patient is awake, alert, and nervous about the transfer. Vital signs were stable overnight. No reported chest pains and palpitations for more than 24 hours. The patient is on a heart-healthy diet and ambulating to the bathroom. Transport's here. Once her paperwork is done, she can go. Patient is having a cardioversion today. She was in pre-op yesterday for an eye surgery, but they found AFib, so she'll have a cardioversion today. Patient Lisa Smith is a 72-year-old, was scheduled to have eye surgery yesterday. The pre-op team found the patient was tachycardic and did a 12-lead EKG. The patient was in atrial fibrillation at a rate of 162. The surgery is canceled until the patient's heart rate and rhythm are controlled. The patient was given intravenous labetalol in the ED and 1 overnight. The patient is in a controlled AFib with a rate of 72. The cardiologist was at the bedside overnight and informed the patient that they can get her in for a cardioversion later today. Patient Lisa Smith has a history of hypertension and high cholesterol, both of which they are controlled with diet and exercise, but the patient's blood pressure earlier today was 162/89. They are awake, alert, and deny pain and heart palpitations. They were weaned from a 2-liter nasal cannula to room air overnight. They are NPO for cardioversion later today. They have a 20-gauge IV in the right forearm and 1 in the left hand. Patient just got here from the ED. Patient Mai Cheng is an 81-year-old female who has a history of TTP and presented to the ED from their primary care physician's office with a low platelet count. On arrival, their platelet count was 3, and thereafter 3 units of platelets. The morning lab draws showed the count at 2. The entire CBC was abnormal, but the most surprising was a hemoglobin of 6, and the covering hospitalist told me to wait on the hematologist orders this morning. The patient is intermittently confused and needs frequent reorientation to stay in bed. They have a plasmapheresis scheduled later today, and I don't know what the hematologist will say about the CBC, but I suspect they will transfuse either platelets or pack red blood cells, or maybe both. The patient's heart rate is 100 and blood pressure runs around 110 systolic and goes higher with agitation. They're on 2 liters of nasal cannula with an oxygen saturation of 93. She has an order to titrate the O2, maintain an O2 stat above 92. She has a heart-healthy diet ordered, but she only eats occasionally. She's incontinent of urine. She has a plasmapheresis catheter in her right internal jugular vein.
Hello, I took the vital signs of the patient.
They're all in the system now.
Thanks. Did everyone get their morning care yet?
I am checking. I have 14 patients today. I also did the finger sticks. They're also in the system too.
Thank you. Any patient needing coverage?
Miss Haley's blood sugar level is high.
I'll go check on her first. She needs to be transported immediately. Hello, I'm Ashley. I'm gonna be your nurse for today. Can I get your name and date of birth?
Izzy Hiley, 2/1/1964.
Any known allergies?
Not that I know of.
How was your night?
It's hard to sleep in the hospital. Just thinking, what's next? Can I eat now? They didn't let me eat yesterday because they said I will have surgery today. And now the doctor decided to transfer me to another hospital. I guess the doctors in the facility are not that good.
Let me check your current diet order. If you can eat now, you can actually call the dietary department and give them your selection. Let me do a quick assessment while I'm here so I can get your paperwork filled up also.
Hi, Ashley. The transport team is here for Miss Hiley.
Thank you.
Ashley, call in line 1. Ashley, call in line 1.
Ashley, 4th floor, how may I help you?
Hi, this is the EP lab, and we're waiting for patient Lisa Smith. Is she ready? We'll be sending for her now.
Sure, she can be picked up right now. Miss Hallie, I'll be right back.
Nurse, where's my food?
Hello, I'm Ashley. I'm your nurse for today. You're now going for your procedure. I just want to make sure that we complete this checklist so that we have everything that is needed.
But my husband's not here. He went home to get my stuff, and I want to make sure he's here to hear all the details.
They're actually waiting for you at the EP lab. The cardiologist was here last night. Did you not talk to the doctor performing the procedure about the surgery before you signed the consent form?
Yeah, he talked to me, but I want to make sure my husband's here for everything.
They're actually here for you, and your paperwork are almost completed. I can have your husband follow you to the EP lab as soon as he gets here. We need to get this done for you so that they can start your procedure that is scheduled for today.
You can scoot over.
Mom, are you okay? Help! 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 Somebody help! My mom needs help right now. Mom, are you okay? What is this? What's going on?
Help me to get up.
Grab me some gauze and towel.
Help
me to get up.
Mom,
The chicken.
what's going on?
Backyard.
What's happening?
Help me to get up.
Somebody talk to me.
I will call the doctor right now.
You should have done this a long time ago. She's the priority right now. Is this your first day as a nurse?
I'm so sorry. I'm trying my best right now. I will call the doctor right now.
This is unacceptable. This is neglect. I need to speak with the charge nurse. Who's in charge right now? Mom, are you okay?
Hi, I'm Michelle. I'm the charge nurse, and you are?
I'm her daughter. I have the power of attorney.
Okay, can we step out for a minute, please?
Why are you getting me out of the room?
Let's just step out for a second.
Mom, are you okay?
Rachel, please stay with Ashley.
Get up. I need to feed the chicken in the backyard.
So we're here to debrief about your stimulated clinical experiences, but I just want to say first that this is a safe container. Mistakes are not punishable, but I want us to learn from it because they're pieces of the puzzle that we're going to put together. The main goal is to learn. Do you agree?
Yes, it's always reassuring to hear that.
Oh, I think I made some big mistakes here.
Okay. So we're definitely going to reflect on what happened in the simulated experience. But first, I want you to complete your worksheets that were given to you.
Is this an additional DML page for today? Because I have printed out this from Blackboard.
Yes, they're a modified version because we took care of 3 patients today. So first, what I want you to do is to complete the 3 boxes. You're going to talk about the patient's stories, and then we're going to talk about it. So if you fill out the first pages and fill out the boxes, then we will continue on. These worksheets are for your records. They are a reflection of your experiences, and they are yours to keep. I'm going to start writing on the board as you talk about those patients, but I'm going to give you a few minutes just to complete your thoughts on those pages. Okay? All right. Yes.
Asa Haley, 59 years old, is waiting to be transported to Metro Hospital Center.
So what do you know about the patient's medical history and about their condition?
The patient is being transferred because she has medical conditions that put her at risk for surgery.
All right, so tell me a little bit more about the patient's condition.
Oh, she has a long history of smoking, hypertension, diabetes, and her diagnostic came back with severe cardiac damage.
Okay. So we're going to continue to talk about the next patient.
Patient number 2 went to the EP lab for cardioversion. She had a scheduled surgery but got canceled because it was discovered that she had AFib.
Okay.
And that she has to be treated first. She wanted her husband to hear the doctor's explanation too, but he wasn't there when the PT went for the procedure.
Okay. Okay, so that's a great summary, Gerald. What's the patient's name?
Oh, the patient's name is Lisa Smith.
So, Ashley, what is patient 3's story?
I was really surprised by the patient and the family member.
So I want you to hold on that thought, though, okay? We will explore the situation in a moment, but we need to describe what's going on with the patient first.
This is Miss Mai Chang, 81-year-old. She's confused. Her daughter was very upset because she pulled her IV line out and she was bleeding and she almost fell out of bed.
So that's a great description of the patient situation. So tell us more about the story, about the condition, and about any history that we should know about.
She has a TTP, and she has very low platelet count and hemoglobin of 6, and a scheduled plasmapheresis this day.
All right, so now that we've explored the patient's story, all right, so let's go ahead and reflect a bit more. Talk about the actions that were taken, the behaviors that were done, the responses from the family members, and what happened during the simulation, right? As well as what decisions were made, right? So at this point, I want to encourage you to all just kind of talk more about your observations in the scenario.
After I received the report from the off-going shift nurse, I communicated with the tech, and I got alerted that transport were waiting to get Miss Azib Haley out, and they needed me to sign. I got busy, and then there was also transport from the EP lab to pick up patient Lisa Smith.
And they did not wait for her husband to come here anymore because she is set to have her procedure done. And then the family member of patient Mai Chang yelled out for help because her mother is bleeding and then almost fell off the bed.
Okay, all right. So what happened next? What were the actions of the RN?
Well, I was able to send off both patients needing their procedures done, but I felt sorry that I wasn't able to assess Miss Mai Chang. That resulted in her pulling her IV out. The daughter was very angry, and I felt helpless and verbally abused. I was ready to cry.
Okay, so this sounds like one of my worst days as an ICU nurse, right? But I want us to kind of take this moment to just reflect on the priorities of the patients and then talk a little bit more about that, all right? What are your thoughts about the order in which the priorities were set? What are the bases of how we prioritize and what we're prioritizing in terms of our nursing care that we give to the patients?
We should look at the urgency of patient needs, and then we have learned some ABCs.
Okay, all right. You are definitely correct about that one, Lindsay. So then looking back at the 3 patients that we had, who needed to be cared for first?
I think it should have been Miss Mai Chang.
Okay, so explain that a little bit more.
I know that her platelet count is low. She's at risk for bleeding. Her IV site may be exposed. And I'm also concerned if she's a fall risk. She's also confused.
Ashley, I know you were the primary nurse, so can you share your thoughts a bit about your priority in terms of the tasks, in terms of when you saw Miss Haley and Miss Smith first?
Well, the staff for transfer and EP are there, and I felt pressured. I really know that they're not priority per se, but I thought that if I could get them done faster, it should not take too much of my time. But once I got in their rooms, they needed much more care, and I got stuck.
So I hear you. What I want us to kind of talk a little bit more too, because I've had similar situations, is to talk more about the collaboration and the teamwork that you saw during the simulation in terms of between team members.
Oh, yes. Some case studies about getting some help when completing care tasks, looking for resources and team members to delegate.
Okay, so knowing these options, how would or how should the RN have applied this type of care to all 3 patients that she had? So now I want you to tell me your thoughts about Ms. Cheng, all right? What do you think about Ms. Cheng's daughter's actions towards the RN, as well as the RN's response to her daughter?
It made me uncomfortable. I felt insulted and humiliated. I did my best, and that was not intentional at all. And yes, I can understand that the daughter was angry, but I just froze.
So in this situation, what could have been done by the RN and other team members?
Well, we could have applied, but we have learned about therapeutic communication with patients and family members, and diffusing potentially violent situations.
Okay.
But I can understand how hard it is to actually apply them when in real situations.
Okay, it's understandable. So what will help the RN apply these communication tools in this case, right? What tools have you had in hand for her?
I could get my charge nurse to help me to talk to the daughter, but overall, I really wanted to gain confidence in myself and in my decision-making skills.
So now let's review some of the critical decision-making points for this scenario. What situations like this will we encounter or can we encounter in the future, and what will we do differently?
Well, in this situation, the patient who needed care most was seen last, and then as a result, it leads to risky conditions such as potential for fall and bleeding. In the future, I will definitely check on the patient first just to make sure the patient is situated.
So that's a great reflection. So do you have any other critical decision-making points that you want to share?
There was also a matter of responding to family members who are angry and verbally abusive, and therefore inadequate action by the RN. If I'm in that similar situation, I need to ensure that I do something different to diffuse that situation.
Great. So we are at the end of our debriefing session. This simulation was aimed to provide us with a learning experience for you to help prioritize your care, as well as to collaborate with other healthcare teams, and to obviously communicate therapeutically with both the patients and their family members. So you encountered issues related to untoward outcomes when your decisions were made correctly, depending on what happened, right? So at this point in time, I'm going to ask you to share some takeaways that you learned from this experience. So who wants to? Okay, so Ashley, you want to go ahead and start first?